Well, the Trump administration has issued a warning to more than 500 hospitals in America, and it concerns secret pricing. And to talk about this knowledgeably, I thought we'd invite in Andrew Bremberg, who served as Director of Domestic Policy Council under President Donald Trump. Andrew, welcome back to the program. How are you?
Great. Thanks for having me.
So tell me about this warning that we're giving to hospitals saying you can't have secret pricing. What are we concerned about?
Yeah, this is a great announcement this week by the Trump administration. If you go back to the end of President Trump's first term, he did a really important new regulation requiring that hospitals post their prices and actually, put out what are their actual prices, what are their cash prices, what are their negotiated rates for all their services. This was a rule done at the very end of the first Trump term, and it didn't go into effect until the very beginning of the Biden administration. And for years, people have complained that hospitals have not complied with this rule, or they've put out these files that are full of garbage with no real data to help patients understand the real cost of their care. And finally, just this week, we saw the Trump announcement announce that they had issued warnings. They were going to fine up to now 500 hospitals for not complying with this rule. And I'd add, last year, in the first year of the Trump administration, they came in and strengthened and improved that rule already, and gave hospitals warnings, said you need to take this seriously. They said you had till April 1 of this year to get your files, prices in order. They gave them time, and now they've announced going after 500 hospitals. I mean, that's a lot of hospitals around the country that have been hiding their prices, and it's great that there's finally accountability to make them, comply with this.
Okay, Andrew, allow me to ask a couple of stupid questions, because I like to ask stupid questions, but Is it that difficult to cite what the prices are? If you went into almost any retailer in America and said, what does this product cost? Unless they're sort of playing games with the pricing, meaning, well, we charge more to some of our customers for this than others, they'd be able to tell you this is what the product costs, this is what we pay for it, and this is what we charge the customer. Unless they're playing games, saying, well, for certain insurance coverage, we'll charge full price. For these guys, we'll charge less. And for these folks over here, we'll charge a third price. Is that why the hospitals are having such a tough time complying with this?
Oh, absolutely. Absolutely. Healthcare right now is completely dysfunctional. You're raising the exact issue that all throughout our economy, anytime anyone goes to buy a good or a service anywhere, you know the price, you can negotiate the price, you can shop around for different prices. No, it's basic capitalism, basic markets 101, which does not happen in the healthcare sector today because there are no prices. And that's something President Trump, instinctively understood in his first term, that in order to have, negotiating power, the great negotiator, you have to know what prices are. So that's why he put forward the requirement, but it hasn't been, enforced. It hasn't happened yet. So now I think we're going to see hospitals take this seriously, post their prices, and really empower both individuals as patients, but also employers. This is something most people don't understand. Most Americans get their health insurance coverage from their employers, and their employers are dependent upon big insurance companies to help provide that benefit to their workers. And they don't realize sometimes that they're getting hosed, frankly, and that they could be paying way less for the same service if they just directly contracted with the hospital on behalf of the workers. So this is why making these prices public is so important.
Sorry about that, Andrew. Because one of the things, I don't know if you've seen it, but some of the reporting on stores that are beginning to use sort of flexible pricing or literally digital pricing that can change during the day and that sort of thing. And I've had the most visceral reaction from people to that whole idea, because nobody wants to think, if I walk in and I pick that off the shelf, it's $5. But if somebody else walks in to get it, it's $3. And then there's somebody else who will pay $10. That's what the hospitals are doing. They're selectively pricing. And if any private company actually tried to do that, and if they said, if the guy walking in or the gal walking in is wearing a nice looking watch and a nice pair of shoes, make sure you mark the price up 10 or 15%. But for the guy who looks like he can't afford it, we still want the sale, so knock the price down a little bit. That would be illegal in regular retail, wouldn't it?
You would think so. And, the irony is I actually don't even think the hospitals are that kind of, conniving about it. In effect, I think what they do is they just try to overbill everyone who walks in the door, right? To say, oh, they came in, let's upcharge, let's upcode as much as possible, and let's see what they or their insurer will pay. Oh, they pay it, great. oh, they're pushing back. Well, maybe we'll have to knock something off and do this and just kind of keep pulling down from that. And that really hurts people in two ways. One, I mean, the most obvious way is that it hurts patients that get hit with these huge or surprise bills, and, get potentially brought into medical debt, go into bankruptcy, and a huge problem there. But I think one thing that most people don't, and that's deeply sympathetic, but one thing most people don't understand how this hurts everyone literally every day is when the hospitals do the same thing, but the person's insured through an employer plan, and the employer plan pays the ridiculous rate. And what that does is that suppresses wages for workers across the entire country. Yep. And we have to stop this. I mean, we don't want socialism. We need markets, and markets work. They work at lowering prices, improving quality, improving options, but we do not have markets when it comes to the purchase of healthcare services driven by both hospitals and insurance companies. And one thing I wanted to add too, I mean, this is a big week for healthcare in the Trump administration. They announced this fantastic enforcement effort after 500 hospitals. And then the White House's fraud task force just yesterday, I think, announced that they're going after the health insurance carriers that work for the federal employee health program that covers insurance for all the federal employee workers, our tax dollars that work. They're going after the health insurance carriers that provide that benefit because they know there's fraud there. So that was a great announcement we saw there, that the administration is now kind of finally taking action to deliver on the president's plan, his great health care plan he announced earlier this year, to deliver, maximum price transparency, and then to hold, hospitals and big insurance companies accountable.
I like that you gave me that perspective. Overbill everybody. And if some of them complain about it, then knock the bill down a little bit. But basically, let's overbill everybody. And what is Donald Trump's response? You remember when he told Boeing, hey, we're not building a new Air Force One for $4 billion. Give me a better price. And all of a sudden, all they had to do was ask for a better price. And all of a sudden, the aviation company said, sure, we could deliver it for $500 million less. Yes, Mr. President, we can get that done. That's Andrew Bremberg, who was Director of Policy for Domestic Policy Council under President Donald Trump. Andrew, thanks so much for the time.